When going in for a breast augmentation, the biggest doubt the patient has is regarding the volume of the implant, the dimensions, the size of the implant, and accordingly what kind of result they will get. In this video, I'm going to be talking about how to choose the size of the implant, how a patient should talk to their plastic surgeon, what are the different parameters that a plastic surgeon considers while choosing an implant for their patient. Hello, I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics and Plastics. When talking about the size of the implant, the first and foremost step is clinical examination. When a patient comes in for clinical examination, we usually take measurements. We assess the different dimensions such as the diameter of the chest, the distance between the sternal notch and the nipple, the distance of the nipple to the inframammary fold. So all of these things, and apart from that, we also check tissue thickness. What is the thickness of skin in the upper part of the breast, in the lower part of the breast, and in the inner part. All of these things, when put together, give us an idea as to the range of this implant that should be put into that patient. When we do all these measurements and check the tissue thickness, this gives us a range of the implant that has to be put. So we can get the lowest volume and the highest volume, and we advise our patients to choose an implant within this range. Depending on their personal preferences, depending upon what kind of result are they looking for, we can advise them to go for a higher range of the volume or a lower range of the volume. If an implant is chosen below this range, then it is very likely that they will not be happy with the result and it will be an inadequate augmentation. If they choose an implant which is beyond this range, it is possible that this implant will not sustain itself in the body for a long period of time. It will lead to complications and hence a need for revision surgery very soon. So next comes sizes. Sizes are given by the implant companies in order so that the patient can put these sizes in their brassiere and can have an estimate of how they will look and feel after the breast augmentation. Sizes come in different sizes, they come in different volumes, and accordingly, when we tell the patient that this is the range that should be chosen, then they can put a sizer in the lowest value of that range and also in the highest value of that range and see what kind of result they will be getting with a higher volume and a lower volume. The last point that we usually discuss with the patient is regarding 3D simulation. So we take photographs of the patient and then we put it in the software, and there we can put different sizes of implants in the patient's 3D projection and then get an estimate of how they will look in the post-operative period. These software can also put the patient's body into animation such as walking and running, and also show how the implants will behave when the patients move. So this 3-step process is absolutely essential in developing a clear picture between the patient and the surgeon so that both of them are on the same page and the chosen implant is absolutely right for that patient. What happens if we choose an implant which is beyond the size that is correct for a patient is that the tissues are simply not strong enough to hold the implant for a long period of time. The implant then can lead to complications like displacement, descent, bottoming out, pseudoptosis, and all other things, because of which they will need a revision surgery in the next 3 to 4 years. The result of a breast augmentation is not determined by the 1 month or the 2 month or even the 1 year result. The result is determined by the 10-year follow-up or the 15-year of follow-up when the patient comes to us and says, I have had this breast augmentation by you for 10 years and I have not had a single complication till now. That is the mark of a very nicely done operation, because if the complications occur within the first 3 to 5 years, then either the implant which was chosen was wrong, or either the technique, there was some problem with that, or there was some minor issues which led to a need for revision surgery. So when you are choosing an implant, you must ask your surgeon to take the measurements and listen to them when they tell you that this range should be good for you. One common point that patients bring to us is that my friend had an augmentation with an X volume of implant and they have got a very nice result, and we want the same implant to be used in us. That can certainly be done if the physical parameters of your friend and yourself are same. If the physical parameters are different, then a different volume of implant may be required to give you the same result. For example, to achieve an increase in cup size from B to C in a patient who's 5 feet 1 inches is absolutely different from a patient who's 6 feet. The volume required to achieve the same result will be higher in the 6-foot patient and lower in the 5-foot patient. So this is an extreme case, but this is an example to show you that you should never compare yourself with others. If the others have achieved a good result, it's not because of the certain volume of implants, it's because the surgeon was very good. So you can go to the same surgeon, you can ask them what size would be best for you and how you can achieve the same kind of result. Thank you for listening to this video. If you have any questions, please mention them in the comment section. Please like my video and subscribe to our channel.